Hello, I'm Woolley. I'm the Chief Executive at Hospice in the Weald. Thank you for watching this short film. I wanted to take the opportunity to tell you what Hospice in the Weald is doing in response to COVID-19. During these difficult times, first and foremost, people still need a dignified death and still need hospice care. I want to reassure everyone in the community that we serve, patients, those important to them, our supporters, our workforce, everyone, that we're still here and still doing everything that we would have done before COVID-19. In fact, we're doing more. The challenges of living with a terminal illness are hard at the best of times. And in these worst of times, then our patients need to know that we are there for them. And we'll be here all the way through this pandemic and beyond. I also wanted to explain a little of, as well as providing our existing care, of what we are doing at Hospice in the Weald to lessen the burden on the NHS. We've created a community charter to set out how we'll work with our NHS colleagues and other partners to ensure that a dignified death is at the core of all that gets done. You can find a copy of that community charter on our website. As I'm sure you can imagine, the demand on our services has increased during this COVID crisis on our Hospice in the Home team, on our ward at Pembury, and on cottage hospice. We have had to change the way that we deliver our services and to repurpose some of them. We are going to keep cottage hospice as a COVID-free site, and we're going to test all patients before their admission to cottage hospice. The 15-bedded ward at Pembury will take patients who may or may not have COVID. We have already treated many patients with COVID and continue to do so. Infection control and our use of PPE is important at both sites, but we will make cottage hospice a COVID-free site with a ring of steel to ensure that patients remain COVID-free. The reason to repurpose all of these services is to see more and more patients. We are going to help lessen the burden on the NHS by seeing newly diagnosed COVID patients who may need our care because it isn't appropriate for them to go to a hospital. We've continued to deliver our counselling and support service throughout the COVID period, and we are seeing more and more patients and the people important to them to help them with counselling through this difficult time. In respect of keeping the social distance, we're doing most of these consultations using the technology available, and we've offered to see any loved ones who have lost someone through the COVID crisis. For many hospice patients, this time is very difficult and lonely. We are staying in contact with our patients and offering them all the support that they need. I want to reassure you that if you or someone you love needs hospice care, then we are there for them. The impact of COVID-19 will go down in history, and social distancing will be remembered as part of that. Hospice in the Weald will practice social distancing, but we see it more as physical distancing. It's never been more important to keep in touch with people socially. Calling each other, using social media, we must keep in touch. You may have seen in the news some hospices saying they face the threat of closure. This is not the case for Hospice in the Weald. Over many years we have been prudent and built up financial reserves with the intention of spending them on some capital projects. We now plan to spend some of those reserves in order to weather this storm. Hospice in the Weald is doing all we can in these unprecedented times to care for people that are dying. In many respects, the hospice staff and volunteers are the unsung heroes in this crisis, and your support over the years has made this possible. We couldn't do it without you, so thank you.